Viruses have the nature to come up anywhere from the wildlife in a jump to the human nature and to the humans and contaminate humans and then spread from there on. It can happen anywhere in the world. The famous so-called swine flu origined in North America. No one called it North American virus. There is, in our interchanged world, the viruses happen to be everywhere. It's a question where they jump, and the exact origin, whether it's a market or whether it was there, is under investigation. That will be important for scientists to find out, but this is not an importance for the naming.
But Christian, sorry, I will pursue my colleague's route as well. And everybody who knows I have a real passion about where the food chain comes from, especially the meat food chain as well, in order to work out how and when we can get away from this and how we can move on from this and how we can not repeat this incident again, and perhaps even something more devastating than this pandemic. And we have to know how these viruses enter the food chain and what we have in our food chain and the way we live our lives and the way we treat our food and the way we give antibiotics to the food chain. We have to understand this. So it is very important, isn't it, to work out how this got in and to identify this case. I don't understand why the WHO is so reticent.
It is extremely important to understand where the virus originated, and the first missions were already looking into this extremely in detail. Food markets have been closed down, so this is not news. But again, this is not an isolated situation. If we're talking about viruses in general, exactly what you're saying is right. Viruses on a daily basis jump from the wildlife to the human life, cross-infect us, and the food chain is another example for many other diseases we can get from this. So this is a concern worldwide, and this is something the World Health Organization has been looking into detail since long. But again, the point here is that this origin in most likely, that's not yet established, in a wet food market in China. The source has to be eliminated, absolutely correct. But for us right now, the most important part is to eliminate or to cut transmission from human to human in each of our countries globally.
Christian, I want to ask you about the advice now, because when we spoke to your organization about 5 weeks ago, you mentioned that you were not supporting travel bans because people would effectively try and get to where they wanted to go no matter what. But at this point, we have seen travel bans across countries. There's talk about in countries, military-style lockdowns. Do you support those types of measures at this point?
So what we're saying is we need a comprehensive package of actions. The whole goal of everything right now should be to cut transmission and to contain the virus as good as possible, because the health systems globally cannot cope with a fast or quick or strong influx of many cases at one moment in time. Hence, we need to slow down the curve and slow down the spread and try to spread it over time as good as possible so that the health system can cope, so that production of vital medical equipment can cope. One thing is cutting the transmission by testing every single patient and following up on them, every single suspect case, and following up with their contacts. The other part of the package is the various political measures, be it social distancing, be it or quarantines, or whatever countries have deemed necessary as the best for their individual situation.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.